Hey, future medics, Tina here, your medic mentor. And today we're continuing our antiemetics, talking about Phenergan, generic name, promethazine. Now, Phenergan is an antiemetic, but also an antihistamine. Phenergan blocks H1 receptors. Those are histamine receptors, antihistamine. But it also blocks your dopamine receptors in the brain's vomiting center. Now, this dual action is very helpful. It helps with nausea and vomiting, and also very specifically helps with motion sickness. But because this one crosses that blood-brain barrier in the vomiting center in the medulla in your brain, it has some sedative effects. So you're going to want to monitor this patient closely. Another important thing to know about Phenergan is that if your patient has been vomiting for a long time, like all day, Zofran doesn't usually work. It's just too far gone, but Phenergan will. So if you've already given Zofran and it just has not helped for your patient, you've given it enough time, and it still doesn't work, you can safely switch to Phenergan, and Phenergan will usually do the trick. The dose is 12.5 to 25 milligrams, and this can be given IV or IO and also IM. Now, this one's really important to understand because this medication is known for being necrotic or causing phlebitis. If it is given IV or IO, it needs to be diluted very, very well so it's not so caustic on your body. Because of that, many services are now switching to IM only. It has a bit slower uptake, still will last several hours, but obviously giving it IM is much slower than giving it IV, but it's not as caustic to the body that way. It's slower to release and slower to absorb. So if you are giving this IV, make sure you are diluting this very, very well, and you are knowing your local policy and how much normal saline you're needing to dilute this one in. Side effects include sedation, we talked about that, also headache and dizziness. They're very slight, but this can, and often does, potentiate, so make grander the effects of other medications, specifically opioids. So be careful with this one. Now, contraindications are going to be known hypersensitivity, but also CNS depression. And when we're talking about that, I want you to remember that patients who have consumed a lot of alcohol are CNS depressed and heavily sedated. This medication already sedates people, and they already have a lot of a CNS depressant on board. You see where I'm going with the two? You see where I'm going? This can depress their central nervous system further, and they might stop breathing. So keep a very close eye on these patients and maybe think about whether or not Phenergan is the right choice for them. Here's your takeaway. Promethazine is powerful and effective, but it's not gentle. Know your route, protect your IV, keep an eye on breathing and vitals. But that's another one knocked out. You're doing so great cruising through these and preparing for your pharmacology class along the way. What a multitasker you are. I'll see you for the next one.